I'm Maricar Centeno from Northfield Foundation Incorporated Philippines, and I will present the survey on the capacity to access information and learning of families of people with Down syndrome. This survey was conducted by Northfield Foundation in partnership with its local partner organizations all over the Philippines and Liliani Foundation supported by Paul Foundation. The COVID-19 pandemic have brought about unexpected changes and adaptation in the lives of all people in the world, including people with disabilities and their families. It caught everyone by surprise, thus making people completely unprepared for it. For instance, face-to-face meetings and gatherings have been very limited to avoid transmission of the virus. Online classes and trainings, seminars, and other activities have become inevitable and have been the primary mode of getting information and learning, especially for people with Down syndrome. They have been discouraged to be exposed to the public due to their immunocompromised health condition, which makes them susceptible to the virus. Therefore, their situation in obtaining information and learning becomes daunting when they and their families have limited or no means and ways of getting this through online during this time of the pandemic. So, as response to the challenge, Norfield's Down Syndrome Project, with the support of the Social Marketing Unit, conducted an online survey to determine the extent or range of gathering information and learning through online by families of people with Down syndrome, as well as the challenges they encountered, which could affect their children's ability to acquire this too. So the following are the objectives of the survey. First is to gather information on the available resources of families of persons with Down syndrome in accessing information and learning. Second is to gather issues and challenges experienced by these families in accessing this. Third is to generate recommendations for organizations Down syndrome project on improving the access to information and learning of both the families and their children with Down syndrome. The survey was conducted at the height of the COVID-19 pandemic, wherein all areas in the Philippines were under community quarantine. An online survey was utilized using the Google Forms to facilitate easier and prompt submission of responses. The link to the survey was sent through electronic mail to 17 local partner organizations of Northfield and to the coordinators of the two family support groups. They were instructed to share the link to the survey to all their beneficiaries included in the Down syndrome project. For parents who did not own any gadget or had limited access to internet connections, the workers or representative of the support groups assisted them by translating the survey to their local language and completed the form based on the answers given by the parents through audio calls. So, the survey generated 183 respondents who were family members of people with Down syndrome from 15 local partner organizations and two family support groups. So these are the profile of the respondents. In figure 3, we can see the distribution of respondents by sex. 95% were female, while 5% are male. Here in figure 4, we can see the distribution of respondents by relationship to the individual with Down syndrome. Most of the respondents were mothers of people with Down syndrome, 90%, 6% were fathers, and 4% were guardian and caregivers, such as grandmothers, sisters, aunties, and service provider of people with Down syndrome. In figure 5, we can see the distribution of respondents by area. Most of the respondents have been from the National Capital Region, with 19% living in Muntinlupa City and 17% from Quezon City. Palawan, belonging to the Region 4B, comes in at third place with 11% of the respondents. So let's move on to the key results of the survey. With regard to the type of gadgets used by the respondents in accessing information and learning, so the results showed that smartphones topped the list. 60% of the 183 respondents shared that smartphones are the primary device they use to access learning and information. So this is almost consistent with the result of this survey that 31% of the respondents have just keypad cell phone. The second device the respondents have at home to access learning and information is their non-cable TV with a 33 response rate. Over 89% of the respondents have no laptops, desktop computers, tablets, and or iPods. So those who have just keypad cell phones, 56 respondents, the function of their phone were only limited to short messaging system, SMS, and phone calls. So accessibility to the internet was another area tackled in this survey, as reflected in Figure 7, available resources at home, internet connection. So, prepaid mobile data was the most popular means of connecting to the internet, especially if there were promotions like free surfing loads. It elicited 124 responses. On the other hand, there were 33 respondents who have access to the broadband internet, such as digital subscriber line or DSL and wireless fidelity or Wi-Fi with high-speed bandwidth connection, while 12 relied on computer shops for accessing online learning and only 9 have postpaid mobile data. So as we can see, there were also 29 respondents who had no means and ways to connect to the internet. And there were 13 who mentioned that they would source the internet connection outside their home, such as free Wi-Fi coming from public sources such as library, barangay, or municipal home, or from a relative or neighbor. So this is an unlikely arrangement since community quarantine during this time is still being implemented. Second is the challenges in accessing online information and learning. A persisting challenge encountered by the respondents in different parts of the country was the erratic or intermittent mobile or internet connection. First, 98 of the respondents expressed difficulty in having a stable internet connection, thus affecting their means to access information and learning through online. So it was followed by 96 respondents shared that they had limited budget to get information and hampered their opportunity to learn. On the other hand, there were 42 respondents who expressed that they were not knowledgeable in using or navigating their gadgets. And another 11 of the respondents mentioned that they had unstable power supplies in their areas. So, third is the respondents' suggestions for improving their access to online information and learning. So, consistent with the result previously mentioned, 41 of the respondents shares that ensuring a stable mobile or internet connection could greatly improve their access to information and learning using their gadgets. This was followed by the need to have gadgets or devices such as smartphones, tablets, laptops, or computers. For 28 respondents, it was crucial to have provisions for load support in order to ensure continuous internet connections while accessing information and learnings. So as we can see in this figure 9, it is interesting that there were still 25 respondents who expressed the need for providing printed materials or modules and home-based and community-based activities for them to continuously receive information and learning during the pandemic. So this was further stressed by 6 respondents who emphasized the importance of training parents and other family members on teaching and managing their family member with disability in the home setting. So from the key results, the following are the recommendations. So in order to facilitate or assist families of people with Down syndrome in accessing information and learning during the pandemic, the following recommendations are given. First is the provision of gadgets such as tablets to people with Down syndrome and their families, especially those in the lower socioeconomic status who are beneficiaries of local partner organizations of Northfield to ensure continuous learning. Second is the provision of financial assistance to purchase load or data for continuous mobile or internet connection. Third is the provision of printed modules as support and or alternative for online learning in relation to teaching and managing children with disabilities. So since this survey was conducted during the height of the pandemic, most of the recommendations were already applied by Northfield and its local partner organization in the implementation of its Down syndrome project. Again, the survey was conducted by Northfield Foundation in partnership with its local partner organization all over the Philippines and the Leone Foundation supported by Paul Foundation. Thank you.